Case presentation. Today we're treating a 21-year-old woman who came to our clinic with ear pain and hearing loss. During the endoscopic examination, I found a large plug of impacted earwax, completely blocking the ear canal and covering the eardrum. Understanding the condition, earwax normally protects the ear canal by trapping dust and debris. However, when too much earwax builds up, it can become tightly impacted. This may cause hearing loss, ear pain, a feeling of fullness, tinnitus, or even dizziness in some people. How the earwax was removed under endoscopic visualization. I first used a fine instrument to gently separate the earwax from the ear canal where it was attached, taking care to minimize discomfort. Once it was loosened, I used forceps and a small hook to carefully remove the large earwax plug. Finally, any remaining small fragments were gently cleaned away with a cotton-tipped applicator, leaving the ear canal and eardrum completely clear. If you have symptoms such as hearing loss, ear pain, or a blocked ear, avoid trying to remove earwax yourself. An ENT specialist can safely remove it using the proper equipment while protecting the ear canal.